New initiative today from the White House to get 70% of Americans vaccinated by July 4th. We're talking about that with Dr. Daniel Koritzkis, who's chief of the Division of Infectious Diseases at Brigham and Women's Hospital. Dr. Koritzkis, good to see you.
Good to see you, Ben. Good afternoon.
Good afternoon. All right, so part of the plan announced today includes extending hours at vaccination sites across the country, including pharmacies, free drop-ins at child care centers so parents can go get vaccinated. Do you believe that convenience is what's holding some people back, and do you think these initiatives then might make a big difference or not?
I think these are great initiatives. While some people may be reluctant or hesitant to get a vaccination, there are certainly people who just can't find the time to get vaccinated because of their work schedules, because of childcare and other challenges they may have in the home. And so going to the people who need the vaccine is really a terrific approach and is going to help get many more people vaccinated.
All right, we now know mask policies have been relaxed since the last time we spoke with you here and in many places across the country, with many businesses no longer requiring them for customers. That has workers in some places like restaurants, maybe grocery stores, concerned about safety. What's your advice to those frontline workers who've done so much for us this last year? Even if they are vaccinated, should they keep wearing the mask? Should they take extra precautions if they're working inside or maybe in a place that has larger crowds?
Well, we certainly owe our gratitude to these frontline workers. I think if they are fully vaccinated, they should not be concerned. They are going to be well protected. Anybody who is concerned, or if they're immunocompromised, could still wear a mask. And I think employers should be lenient in allowing employees who wish to continue wearing masks to do so. And of course, when you're done with your shift and you're going home, remember to wash your hands.
All right, some viewers have asked us if they are fully vaccinated and suddenly find out they've been infected with COVID-19, one of those so-called breakthrough infections, with minimal symptoms, what do they do? Do they need to notify work or friends? And do they need to quarantine? What is the guidance on this now?
Well, I think people who have become infected despite being vaccinated, if they're having symptoms, they need to stay home until 10 days after their symptoms have resolved and at least 24 hours without fever. They may have special requirements if they work in a healthcare setting or in a residential care facility. You should certainly, out of courtesy, notify your close contacts and, if required, notify your employer.
All right, the CDC is now lowering its forecasted numbers for continued deaths and hospitalizations tied to COVID-19. I saw one of your colleagues actually tweet last night that there were 2 COVID-positive patients in the entire Brigham as of last night. That's incredible. So from your vantage point, what is the situation in our region right now, and how sick are the people who have to be hospitalized?
We are seeing the lowest numbers of people with COVID ever since last summer, even lower than last July and August, and that's just terrific. We've had no patients in the intensive care unit for the last several days, which is wonderful. People who get hospitalized are pretty much like those who were getting hospitalized before, usually people who have many symptoms, especially the need for oxygen, and may have a lot of pre-existing conditions that make them at risk for progression. But it's just terrific to see these numbers come way, way down.
That is great news, and it's news we are very welcome after this very long 15-month period. All right, Dr. Daniel Koritzkis, Chief of Infectious Diseases at Brigham and Women's. Good to see you.
You're very welcome.